Hello, CPA members. This is Erica Peyer from the CPA office. Thanks for joining today's webinar. The purpose is to do a refresher of the offerings from PRS Pharmacy Service and the Compliance Track suite available to you through CPA. We have had a relationship with PRS since December of 2018 with the objective of helping members with the daunting task of keeping up to date with policies, procedures, and training as required by state and federal agencies. If anyone needs a refresher on how to access the offerings through CPA, the CPA or PRS staff are able to help you with that, or just log onto the CPA website and click on the Compliance tab. I want to thank Joshua Potter, Director of Compliance at PRS, for putting this webinar together today for us. Joshua and the team at PRS are extremely responsive, and we appreciate their partnership. PRS is recording this presentation and will be providing it to us to post on the CPA website following this, probably early next week. Feel free to submit questions throughout the presentation, and Josh will answer those questions at the end. Josh, I'll turn it over to you.
All right. Thank you, Erica. Good morning, good afternoon, depending on where you're at. I'd like to thank everybody for attending today's webinar. I know you guys are all busy, so I'm going to kind of go through the programs themselves, kind of go through what some of the tasks are, the annual tasks, periodic tasks for each program, and then also cover a couple other things related to pharmacy at this moment in time in the country. So for most of you, you'll be logging in, from the CPA website. You'll go to the Compliance tab, as Erica said, and hit the Connect button, and that'll take you to the site that you guys all see right now on the screen, on your computer screens. So what this is what we call our Home tab. This is whenever you log into the program, this is the very first place you're going to come. And what we see here is we have a menu at the top. On the right-hand side, we have a list of our pharmacy and then whatever programs are associated with that pharmacy. If you do have more than one pharmacy, most likely those pharmacies are going to be in different accounts, so you have to log in separately from CPA based on what account you have toggled on your CPA screen. But we are also able to combine accounts into one account that will give you a pharmacy, basically stacked on top of each other. So in this example, this screenshot here of our, kind of our demo account here, I actually have 3 pharmacies actually on this one account. So I have our first pharmacy, just PRS Pharmacy Services C-Track Suite, PRS Pharmacies 2, and PRS Pharmacies Latrobe. So if you do have more than one pharmacy on an account, they'll be listed here. If you do have several pharmacies and they're on separate accounts and you would like those to be combined, you can just give us a call and we'll get that taken care of. And I'll cover our contact information at the end of the webinar. So once you do log in, this is what you're going to see. The pharmacy information. Over here, you're going to see at the top right now, you'll see a Pharmacy Technician Immunization Administration Training Program, which I'll cover briefly at the end. Right below that, we have our training dials. These refresh once a week, so if your technicians have gone through their training today, yesterday, or so forth, if you wanted to refresh, you can just hit this link right here and automatically refresh these dials, and that covers all the programs inside each pharmacy will have its own training dial, so you can kind of see where everything's at, training-wise. Once training has been completed by all your employees, you're able to actually basically get a attestation to training completion. This attestation is only available once all of your employees have gone through the training itself, and it'll basically print out a certificate saying as such. Below that, you will see any licenses that are nearing expiration, and they'll be broken down by employees. Here I got the first one, our employees, and then facility ones. Then your facility license, and then in this case, I also have a vendor licenses that you're able to input into the system, depending on if your state requires, a particular vendor to have a license. That might be an oxygen supplier, or it could be maybe using a consultant pharmacist to do some of your MTMs and things like that. But going back up to the top of the screen, we have a couple different things here that I kind of want to go over here. The first is the navigation tab. Now, the navigation tab is basically Everything under the navigation tab is those things that you're going to hit fairly often. Now, the facility tab is, for you guys, will be blocked off. If you go in there, it'll say this has been closed off. If you do need to change information related to your pharmacy itself, phone numbers, addresses, things like that, just give us a call and we can make that happen. Below that, we have login information. From here, you'll be able to see all your logins that you have assigned to the program. Most of you will just have an email address here, so there's not a CPA-based address here. There's nothing you can do to that. But if you do want to give your pharmacy managers and things like that access to it, I know you can do that via the CPA website by giving them permission, and that will give them permission to log into the website. The next tab is the Personnel tab. So this is where you can add all your employees just simply by clicking the Add Personnel, which is going to have you complete some information, specifically first name and last name. Everything else is optional, but first name, last name, maiden name, and why that is important is when we do the exclusion checks on a daily or monthly basis, depending on how you have it set up, it'll make sure that it does check that maiden name also. Date of birth. Date of birth is important for the exclusion checks also. It allows us to actually narrow down any false positives and things like that. Date of hire and date of termination. This is of importance for our VER I-9 program, which I'll briefly go over later. Basically, this is if you put in a hire date and a termination date, it'll let you know when you're able to actually destroy a Form I-9. Job description. These are what dictate what training is going to be assigned to that employee. What pharmacy it's associated with. So if you only have one pharmacy in your account, that's the pharmacy that it'll be. If you have multiple pharmacies, you're able to actually select which pharmacy that individual is assigned to. Background check. If you do background checks on your employees, you can put it here, not performed, clear, not clear. Hepatitis B vaccine, again, not performed, or if they declined it, and that's important if you're exposing your employees to bloodborne pathogens. That could be through administering vaccinations, doing point-of-care testing, or even some simple things such as if you're doing some DME that whether it's training or cleaning up DME after it comes back into the pharmacy, that may potentially expose them to bloodborne pathogens. So having a hepatitis B vaccination record is required by law. Personal MPI number. If that individual does have an MPI number, you can put it here. Email address, password, and confirm password. Employees can also log in and only see the policies and procedures and the training associated for them, but to do that, you need to put in their email address, their password, and then you need to confirm that password. When you do that, it will actually send that employee an email and inform them what website they go to log in and what their username and password are. If you ever come back in here and change any of that information, it will resend that email out to that employee. Sorry. And once you've entered all that information, you just click Save. Now, if you put in an email address and do not put in passwords, it will not accept it. It'll let you know that there's no password entered. So if you're not going to give them access to the website, do the training directly, then don't put in an email address. Over on the right, I can see all my employees. These ones that are grayed out have been deactivated, and you can deactivate them just by clicking this red icon, or, for again, Roger Corvin here, if I click the blue icon, that's going to allow me to edit that employee, and I can, deactivate him that way also. Now, if I want to hide all these deactivated employees, in this demo account, we have a lot of them. I can just click Hide, and they'll all disappear. The next thing on the navigation tab is training. Now for training, this is where your employees will go to do their training if you don't give them their own username and password to log in. So if I click on training here, I see a list of all my trainings, or all of the employees' trainings on the right-hand side. For the red bubbles here, that means the training is due now. Green bubble means training is not due. They've gone through it, and if I look over to the right, I can see the date they completed it and its next due date. To actually go into the training, you just click the Start button. And in this example, it's the Medicare Part D and D fraud, waste, abuse training. Down basically the employees are going to read through this. As they finish this slide, they just click this arrow on the right. And that arrow on the right doesn't, there's a delay of about 5 seconds before the arrow reappears to go through the training. Once they get to the end of the training, they're able to print out a certificate. And in cases such as right here, the Flaw Track Code of Conduct, when they get there, they're going to print they're going to be able to print 2 documents. The first document is their Code of Conduct attestation that the PBMs want to see, the Medicare Part D PBMs want to see, and also a conflict of interest attestation to make sure that your employees don't have any sort of conflicts of interest. That's training tab. On the left-hand side, I have various reports that can be run. I can look at completed trainings in the last 12 months, all completed trainings that have been accomplished by any of my employees. I can just look at my incomplete training, and then also any deactivated employees. We don't include those in the report, but you can get to those specifically also. Below that, we can actually change the trend, what we see here to anything, drug supply track. It's just going to show me all the training for drug supply track, one of the programs in there. I can adjust that to just a facility. In the case of this, they're all associated with one of the facilities. So if I was to change it to pharmacies, PRS Pharmacy Services 2, I can see there's no training there. But if I go back to the main C-Track suite pharmacy here, I can see all the trainings there. And then I can toggle between completed and complete and all. The next tab here is the Tools tab, and this kind of just gives you some basic information. It gives you the commonly requested documents, and these are the documents or the items that are requested by PBMs and some state auditors. The name of it, what they're requesting, where it can be found, and what the policy and procedures or form that is associated with. We give you access to data.cms. Data.cms has some, information. Click on it related to the ordering and referring, verifying that a physician or anybody has an MPI number and they're actually able to order, DME or other services. My links. This isn't something that we promote or anything like that, but a lot of pharmacies have websites they typically go to in the morning. We allow you to basically add the links to the program or to the website, and then you can click on those as needed. But again, it's kind of I would call it a gimmick. Equip. I'm sure most of you are probably using Equip. We just give you a link to the Equip website. We don't log in or collect any information from them, so we give you a link there, and then you're able to actually log into Equip, and you have access to all your information there from Equip. And the last thing we have here is My Cloud. From here, you can actually upload documents to us, more for the purpose of storing, but some pharmacies will upload documents to that and then tell us to go check it and verify it and make sure it's, it's completed the way it needs to be completed. A help tab, self-explanatory there, getting started information, manual instructions, some help videos, and then for pharmacies that can do some programming, some API data that allows them to kind of extract data from us. Need assistance, you can email us, obviously. You can call us, or you can request us to call or email you. Now, the request to call or email, that's going to be during normal business hours in most cases. But if you do it after hours, someone will contact you in the morning. For some of the emails, you may receive an email relatively quickly if I'm on the website at night or if I'm working. We'll get that pretty quickly. Some Visit Us. It's just the social websites. And then SARS-CoV-2 links and guidance, which I'll cover in a minute. So that's basically the menu system. Now going back to the Home tab, obviously I see all the programs. Going to briefly go over what each of these programs has in it, and then I'm actually going to go into a program, and we're going to start the periodic task part of the webinar itself. Again, if you guys do have any questions, you can enter that through the GoToMeeting software, and at the end of the webinar, I will go over those questions. And if I'm not able to go to any of those questions, I will be including a Q&A document that goes over all those questions and provides an answer to those when you guys receive information about the website or about the webinar being posted, the video being posted on the CPA website. So looking at this first pharmacy here, I have a list of all the programs that this pharmacy has. And looking at what I have here, these are all the programs that are associated with your CPA accounts. So we do have some other programs, which I'll briefly go over one or two of those, but I want to really focus on these. So Culture Track. What the Culture Track program is, this is basically a program to help with non-discrimination and cultural competency. A lot of the PBMs are now asking for cultural competency training, and a lot of states and parts of the Affordable Care Act require you to be able to properly communicate to your patients. If they speak a foreign language and are not English speakers, in most cases you do need to be able to communicate with them to make sure they're using their medication safely and they understand those requirements that are there. In most cases, your software vendor, your pharmacy management system vendor, has contracts with, RX Trans or something like that, where they can actually make sure that the labels print out in the language appropriate for that individual. Drug Supply Track. These are policies and procedures to comply with the Drug Quality and Safety Act, or Drug Quality and Safety Act. Basically making sure that you're getting your 3 T's, your transaction information, your transaction statement, your transaction history from your whoever you order your medication from. Just going to go into that one real quick. And you go into any of these by just clicking the view button beside it. And what we see here is at the top of all these policy and procedure-based ones, we have a compliance guide. The compliance guide is going to actually walk you through the implementation process. So as you go through the compliance guide, bring that up, it's actually going to kind of give you a background of the program itself, the law itself, any timelines that are relevant. And then you're actually going to get into the actual policies and procedures. And each of the policies and procedures is going to have a link. So you're going to go in and actually be able to touch every policy and procedure and understand what it says. And then below that, individual policies and procedures, we have action items. These are things that you need to do to be compliant today. So as you implement programs, these action items are going to be those things that you implement, specific aspects of that program to make sure that you are compliant. And again, it's going to go through every policy and procedure. There's a lot of policies and procedures in all these programs that you need to have available, you need to have on hand, but there's nothing you necessarily need to do at implementation. So for those, obviously we do not see an action item. But for every program, there is going to be that compliance guide that's going to kind of walk you through the process. After compliance guide, you're going to see some other things, update logs and things like that. In the case of the Drug Supply Track, there is no periodic tasks associated with that. It's really just making sure that you document that you have the 3 T's, and in most cases, your pharmacy wholesaler saves them for you. Below that, we have all the policies and procedures, and then forms. All the forms are going to be indented to the right, so you can just click on a policy and procedure. It's going to bring that up, and all the policies and procedures are going to be set up the same way. Also, I'm going to see the policy, any important terms, if there are any important terms that you need to be aware of, and then the actual procedure itself. And anytime that a procedure has another policy and procedure that's associated with it, there is a link to that policy and procedure. And anytime there is a form that may be associated with it, there is also a link to that form within that policy and procedure. Employee Track. The Employee Track program is basically an employee handbook. This is a version of the employee handbook that we use here at PRS. Basically what that is making sure your employees are aware of information related to actual employment at your pharmacy. That can be what your mission statement is, equal employment opportunity clause, a military and reserve leave clause. So it provides all the information, gives you a template. You can either use ours or you can tweak it to better match what you want your operation to, how you want your operation to operate. Now, with all these programs that are policy and procedure based, if an employee does log in with their own username and password, they'll be able to actually see all those policies and procedures. Only one they cannot see is the employee track, the employee handbook. And then that's for just in case you're not actually using our employee handbook. We don't want to have employees have access to that and use it and think that that's your actual employee handbook. Exclusion Track, it's what it sounds like. It's the exclusion program. On a monthly basis, we automatically check the OIG and SAM's exclusion databases. Right down here, you can actually toggle it to perform those checks daily. I know some pharmacies do like to do that. Legally, you only need to check it on the monthly basis, but to make sure, that especially if you are hiring a lot of employees and you're going through a process, it is important that you do check those employees. So performing daily checks would make that possible. We also give you the ability to do a pre-employment check. Just clicking on that, it's going to bring up first name, last name, and it's going to do a search of both databases. And if it finds a link or finds a potential match, it's going to let you know. But on a monthly basis or daily, you're going to receive an email to your CPA account. I believe it's on the upper part of your CPA website, and Erica can chime in if that's moved. But you'll get an email every day if you do the daily, or at the beginning of every month, letting you know that the exclusion check has been performed. In there is going to be instructions to go to this current report here. Go ahead and click on that, and it's actually going to go through and generate the report based on the most previous exclusion check. Usually it's quicker than that. I'm going to jump back to exclusion list. It's running right there. You're also able to do custom reports. So if you did not print out a monthly report and you want to go back and have proof that you did do a report, just jump back over to the monthly exclusion. And basically what I see here is I can download the report. I see all the checks that were done. When was the date of the last check? The OIG result, the SAM result. I get a possible, and basically what that is letting me know that there is someone with a similar name on the Medicare exclusion databases, or the SAM exclusion database. In this case, it's Will Powers. They don't have a William Powers in there, but they do have a Will Powers, and we look at the diminutive name forms of the name also. In this case, John Smith. We have Jonathan Smith. It's saying that might be a potential match. If it does find a true match, you'll get a plus sign under attestation. And basically what that does is that allows you to click on that plus sign, and it's going to ask you if you verified that this is not your employee. If it, in fact, was not your employee, it's going to allow you to attest it, that particular entry is not your employee, and then in any subsequent checks, we're going to basically skip that line for that employee. So, if we had a match for myself, and it was a false positive, I'd click on that attestation, click that it was not me, and next time I did a search, I wouldn't pop up. If sometime later down the road, another Joshua Potter did show up on the exclusion check database, or the exclusion databases, it would show up as another false positive. We also give you the ability to go back to exclusion We also give you the ability to input your vendors into the system. So you can add entities, is what we call them, and also you can add your doctors. These are more, when it comes to the doctors, those are more designed for any doctors that you may be working with, but you can also put in some of your prescribers also. And it's going to check those on a monthly or daily basis also. You can also just do an exclusion check, this link here, which is just going to rerun the reports. Takes a little bit as it goes through it. If you have a lot more employees, it may take a little bit longer to go through that, but now all the reports have been run again. Going back to the home tab, we have our Flaw Track program, a fraud, waste, abuse program. Probably one of the more common programs that we see pharmacies entering. Clicking the view button here. Again, we have our compliance guide. This is going to be the document that you guys go into to actually implement the program. We have an update log, so if there's been any updates, a lot of times we might have tweaked wording somewhere. If the wording wasn't didn't change anything, didn't change the meaning of anything, we don't mark it as an update. But if that there is a change, then we actually put that in there. In the case of this, we did update the way we were showing the refrigerator and freezer temperature, common refrigerator and freezer temperature requirements. Below that, we see our periodic tasks. Clicking on that, it's going to show me, all my tasks, whether they're daily, monthly, quarterly, every 6 months, annually, other. In some cases, you do it at higher. Who's responsible for it, and then an actual link, to the policy and procedure. So if I click on that, it takes me to the policy and procedure that task is associated with. And then again, we have all of our, educational type stuff associated with the program itself, and then we have all of our policies and procedures that are related to the program itself and all the forms that are related to the program. HIPAA, everybody knows what HIPAA is. This is HIPAA Policy and Procedure Manual. Don't really need to say too much more about that, but we'll cover what the periodic tasks are for that in the next part of the webinar. License track, obviously we allow you to enter your license information, whether that's license information for the actual pharmacy itself, your employees, your vendors, your wholesalers. A lot of you have probably received attestation from some of your PBMs to actually verify that your wholesalers, those companies that you're ordering your drugs through, are either FOD certified or they are registered in your state. And then in pharmacy accreditation, we had a lot of pharmacies that were accredited with, specialty URAC or ACHC or Joint Commission or another specialty accreditation company, some of the compounding accreditation organizations out there. We allow you to put that in there, and it's going to prompt you when that expiration is for all these, whenever there is an expiration that is nearing, you'll receive an email at the beginning of the month letting you know that that expiration is expiring within the next 60 days. OSHA Track, this is our hazard communication standard program. Basically, it's a policy and procedure that we developed to help pharmacies comply with maintaining and storing hazardous chemicals. This could include drugs, but it's not. This is not USP 800. This is considered USP 800 light, very light. But anytime an employer has hazardous chemicals in their pharmacy that are in their establishment, they need to make sure that you have the SDS sheets for that chemical. That you have something called a hazard communication program. Basically, it's a program that you train your employees on to on what they need to do if there is a spill. The first thing they should do if there is a spill is check the SDS sheet, see what kind of personal protective equipment is required based on that SDS sheet, and then clean that according to what the SDS sheet says. So we developed it as that. We threw a couple other things in there that we do here internally at PRS that gives us a discount on our business insurance. So a work environment, basically making sure the work environment is safe. And one of the reasons why we also added that particular one, there was a pharmacy that, for whatever reason, I think that a mishap at the pharmacy and an employee got injured. OSHA did come to visit them. The pharmacy was passed, but based on that owner, luckily they passed and they had done a cleanup a little bit before that. But if they would have came before they cleaned up, they would have been fined. And an OSHA fine is not something that is typically very small. So what this work environment policy and procedure does is just make sure that you have all of your fire extinguishers are in date. There's no boxes or things blocking exits or hallways or things like that. So it's going to kind of walk you through that whole process to make sure that your pharmacy is safe. And it's nothing that, in most cases, common sense is going to help you with anyways. But documenting it here at PRS allowed us to get a fairly significant break on our business insurance. Emergency actions, basically this is a policy and procedure on how you handle emergency actions, basically evacuations of the pharmacy itself. That could be an evacuation, or it could actually be a lockdown inside the pharmacy if something is going on outside the pharmacy and you want to protect you and your employees. Illnesses and injuries at work. Whenever there is an illness or injury at work, you need to make sure you document that. In some cases, that needs to be reported to OSHA itself. Especially, now the most relevant thing is, if someone was to have acquired COVID, one of your employees acquired COVID while they were working there, and you couldn't prove they didn't acquire it there, and all evidence points to them having acquired it there, then it needs to be reported as an illness. The next program here is our Pharmacy Operations Manual. And basically what this one is, this is kind of a catch-all policy and procedure that we see a lot of the state boards requesting that don't really fall into some of the other things here. So this one's a little bit different right now, but it's in the process of being updated to be very similar to all the other programs. So from here, they are able to basically access a PDF of a bunch of different policies and procedures that your state board may be looking for. The ones we see a lot of pharmacies requesting here are the controlled drug items. So on this, we have a whole section for controlled drugs. And basically what this is designed to do is designed to help you comply with all the DEA rules and the best practices that pharmacies should be following. The one thing that we see a lot of pharmacies don't have in place for one reason or another is a power of attorney. Obviously, the owner is able to order controlled drugs, but other pharmacists really cannot order any controlled drugs unless they've signed a power of attorney. So we provide you with that power of attorney, and then also, obviously, if that pharmacist goes away, you want to revoke that power of attorney. That actually just came up yesterday from a pharmacy. Flaw Track, that's just an add-on program. It allows you to enter your weekly RX count. When we get enough pharmacies that use that in a given week, you'll actually see how you compare to those other pharmacies. Now, we do throw out low numbers and high numbers. So if we had a pharmacy that was occasionally we have long-term care pharmacies that are using some of our programs, or I don't want to say mail order pharmacies, but pharmacies that are independent pharmacies that do mail order. They sometimes tend to have a lot more of an RX count. When they give us their numbers, we ignore those because it doesn't fit with the industry averages. PSE Track, that's our pseudoephedrine program. That policy procedure is going to walk you through the annual certifications, training your employees, storing your pseudoephedrine products. QA Track. This is our quality assurance program. And this one is a little bit different because there are some very specific state rules that apply to this. So if I click the view button on this, the first thing it's going to give me is a general. This is for all states without specific guidelines. There are some states out there that have specific guidelines, but they match our general programs, so we don't have them listed. And then it actually gives you policies and procedures for states that have different rules. A lot of those rules are more related to timelines, how quickly you have to either conduct a quarterly meeting or how quickly you have to actually review a medication event or quality-related event. SARS-CoV-2, that's same thing as here. Basically what this is just a running document of links and best practices that can be used by the pharmacy itself on complying with or making their pharmacy safe when it comes to SARS-CoV-2 or COVID-19. And then the last thing, or no, two more. TechTrack, this is just a technician program. We provide you with basically a policy and procedure, a technician utilization manual. This is a blank document that allows you to go in and basically create a technician protocol. I know in the states of Florida and PA, you're required to have something on there that, or something that basically dictates what your technicians are allowed and not allowed to do. And this is a document for actually doing that. And the last ones are VER I-9 track. Again, it's policy and procedure for helping you comply with the Form I-9 requirements. One thing that's different with this program, if I actually click on the VER I-9 instead of the view button, I can actually see all my employees that I have listed, and this is all the employees that have ever been at the pharmacy. And if I had a hire date and termination date, it'll actually let me know when that Form I-9 can be destroyed. If I don't have that information, it's going to tell me that I basically cannot destroy that. In the case of these two employees here, I can't destroy it because A, I don't have a term date, but also it's not, I can't do it yet based on timing. So when it comes to the Form I-9s, you're able to destroy a Form I-9 3 years after the hire date and 1 year after termination, whichever comes first, or excuse me, last. So 3 years from the hire date or 1 year from the termination date, whichever comes last. At that point, you are allowed to destroy that Form I-9. Okay, I'm going to start the periodic task section now. And I'm calling it annual task on here because we are at the beginning of the year. And annual task, that's going to cover all your monthly stuff, all your quarterly stuff, and your biannual stuff. So the first thing I'm going to do is going to cover HIPAA. So if you go into HIPAA, typically, and this goes for all the programs that have a periodic task, either the second or third document in the table of contents is going to be a link to the periodic task. It will look very similar to what you're seeing here on the screen. It'll say the task, what the period is, if there's any other period-related information, who's responsible for it, and what policy and procedure it is. Inside the periodic task document in the program, this is actually a link to that policy and procedure. So I'm going to kind of go over each of these right now to make sure that you understand what is there. And obviously, if we don't make it through all these today, it does exist as a document on the periodic task on the table of contents. And if you do have any questions, you can always give us a call, and we'll make sure that I'll show you where that information is. So software, firewall, router, modem updates, you want to do that on a monthly basis. Basically, you want to make sure that, this is for HIPAA, that all of that information is updated on a monthly basis. This will ensure that security-wise, your operating system, typically Windows, your firewall, your router are updated and don't have any holes in it that have been identified by the manufacturer, or even the federal government in a lot of cases notifies the software vendors and the hardware vendors of these holes. System audits, for a pharmacy computer system or pharmacy management, anybody in HIPAA, if you have a computer system that maintains your PHI, you need to make sure that no one's logging in into that system. No one's trying to hack into that system. Typically, that is done on a quarterly basis for most pharmacies. If you do find that quarterly, you're looking at a lot of these potential events. Typically, you want to move that down to a monthly or even weekly, but I have yet to see a pharmacy, knock on wood, that really had to worry about that. PHI inventory, you need to make sure that you know all the PHI that your pharmacy has in place. And where that PHI is. Obviously, we have a computer system, so your electronic PHI, you have websites that you may store information in, especially if you're in reconciliation online and things like that. Your MTM data may be online on a website. And then you have all your paper stuff, your hard copies, your reports with patient information on it. You need to make sure you know where all that is and you have documented where all those things are. So if anything does happen, you can go look at your PHI inventory and check to see if there was any PHI that may have been, in that area or on that website. Business associate log review and update. Basically, you want to have a log of all your business associates. And in the case of these business associates, you want to make sure that, if there was an expiration date on the business associate agreement, that you have that documented, and when that does come up, you renew your business associate agreement with them. Employee HIPAA training, obviously that's going to be done annually. Privacy evaluation, that's going to make sure that all your policies and procedures related to the privacy rule are in place and there's no issues that you found. Security evaluation, that is going to be any evaluation of the security role. That's going to be your IT type stuff. Basically make sure you evaluate how your pharmacy is handling electronic PHI. Disaster recovery and contingency plan. In most cases, there's nothing you really need to do with that. You just need to make sure that it's still accurate. And a big one here is the risk analysis and management plan. The risk analysis and management plan is something that basically a pharmacy is going to use, and obviously we have a template for it in our program, that you're going to use to basically review your pharmacy operations to make sure there's no holes in the overall security of your electronic PHI. And that needs to be done on an annual basis. In a lot of cases, that stuff doesn't change all that often, so you're just going to be signing saying that you reviewed it and everything's okay. But when we look at some of the audits or some of the investigations that have occurred by the OCR in the past couple of years, risk analysis and management plan is always one of those things they do find providers to be deficient in, and that does lead to issues and fines. Jumping in Flaw Track, same thing here. Obviously, your OIG and standard exclusion checks, they're on a monthly basis. You want to conduct a random compliance review. One of the things with fraud, waste, abuse, there is a document called Chapter 9, the Compliance Program Guidelines, put out by Medicare. And it says basically that dictates what the PBMs need to be looking for. And they also need to have in place on their own side. And basically, most of the things that we consider policies and procedures related to fraud, waste, abuse outside of training are all associated with that Chapter 9. So conduct random compliance reviews. Basically on a monthly basis, you're just going to pick something, and we have a list of things that you're going to look at. And you just pick something from that to just kind of check over. Your compliance officer is going to take a look at it. It might be something as simple as make sure daily reports are run, make sure your hard copies are all available. And they're just going to go through, a couple files to make sure everything is good. Quarterly complaint review. One of the things that any sort of compliance program should have is a way for patients to make complaints. And depending on those complaints, they'll be dealt with at that moment, and then roughly quarterly is typically how you'd want to handle it. You want to get all your complaints together and handle those complaints. Not that most pharmacies get that many complaints, but if you were to get complaints, that's how you would handle it. The next area is compliance committee meetings. Again, the Chapter 9 recommends or states that you should have a compliance committee, and they should meet. That should be done on roughly a 6-month basis. And it can be a compliance committee of one. Basically, you're just going to review the overall pharmacy compliance. Employee training, annually and at hire. Conflict of Employee conflict of interest attestation, again, annually and at hire. Annual compliance assessment. Basically, this is you're going to take all those reviews that you did every month, you're going to take your compliance committee meeting notes and come up and basically conduct a annual compliance assessment to make sure the pharmacy is still compliant. Employee code of conduct and ethics attestation, annually and at hire. License verification. Anytime that you hire new employees that should have a license, you should check with the primary source to make sure that the primary source being the Board of Pharmacy, or maybe, if you needed a technician who was certified with PTCB or something like that, you actually want to go check their website to make sure they are compliant and get a copy of their license. And then the last one here is Medicare Part D attestation. As we all know, typically late August, early September, you start receiving information from the Medicare Part D PBMs that you need to attest. In a lot of cases, you only need to actually go into your NCPDP profile, and on that NCPDP profile, there is a section called FWA, and that gives you places where you can attest. Now, if you're using our Flaw Track program, you're good to go. You just need to go onto the NCPDP website and attest. But some of the payer PBMs, they still will send you either direct links to their website where you go attest, or they'll send you or give you a document that you need to complete and send to them. OSHA Track. Now we're going to kind of get into some of the smaller programs here. OSHA Track, a monthly facility inspection. Again, that was the item that we do here to kind of make sure that we are we're running a safe operation for our employees. You want to make sure that you review your hazardous chemicals on a monthly basis and actually document those and make sure you have SDS sheets. Emergency action plan review, this is your evacuation plan. Typically that's done on an annual basis. And then your annual inspection is also done on an annual basis. Fire safety, want to make sure that any ignition sources and hazards are checked on an annual basis and you have those clearly documented or posted. Hazard communication plan, this is the meat and potatoes of the program. You want to make sure you review that on an annual basis to make sure that it's still in place and there's nothing that you need to change. And then obviously employee training, you do that at hire and annually. Pseudoephedrine, on an annual basis, you need to self-certify with the DEA, and you need to train your employees. VER I-9 track, on a quarterly basis, you want to make sure you have all your Form I-9s and they're available. And then also you can check to see if you're able to destroy any of those on a quarterly basis. So real quickly, I want to go over two programs. These are not part of the normal CPA programs that you have, but they are available for add-on programs, and we do see that pharmacies are looking for these to some extent. Now, USP 800, you need to check with your state board to see if they're requiring you to be compliant with USP 800. And most states have not really made a decision on it yet. As we started to see it ramp up a little bit, COVID hit, so they kind of backed off of it. But obviously, this is how you're going to protect your employees from hazardous drugs in the pharmacy. So on a monthly basis, you want to document how you've destroyed those drugs or disposed of those drugs. You're not really going to be destroying hazardous drugs on your own. You're going to be giving them to a hazardous waste company and they will destroy those. You want to clean any sort of equipment that you're using to handle hazardous drugs. Every 6 months, you're going to do a review of all the potential exposures that are in the pharmacy. Where are all those places in the pharmacy that your employees could potentially be exposed to hazardous drugs, whether that's on your stock area, whether that's in the counting area, whether it's in compounding, is going to be a big one. Making sure that you've identified all those so your employees know where those potential places are that they may be exposed. Personnel training, you got to train your employees on it, and employee acknowledgement. If you are required to be USP 800 compliant, you need to make sure your employees are aware that some of these drugs may be harmful. If they are of childbearing age, some of these drugs could be more harmful. So they need to understand that they are working in an area that has, it's slight, but it has the potential to cause issues. Wipe testing, that's basically doing a test of an area, a counter, a floor, or something like that. Basically, you wipe it and you send that wipe away and to a company, and they will actually take a look at it and see if they can identify any hazardous drugs on that wipe. Assessment of risk. Typically for pharmacies, most pharmacies are just going to follow the standard USP guidelines, but you are able to do an assessment of risk, maybe to limit some of those guidelines to actually make it easier on the pharmacy to operate. Do an annual review on your on the chemicals that you use to clean up a spill. An annual review on any wipe testing that was done. You want to review your hazardous drug inventory. Obviously, you're going to do that annually, but also you're going to do that whenever new drugs come into the market. Annual assessment of your engineering controls. If you do have clean rooms and things like that, you want to make sure you assess them at least on an annual basis, or any sort of drug cabinets, you want to assess them on an annual basis to make sure that they're compliant with the rules, and also conduct an overall compliance review. Exposure control plan. Any pharmacy that is potentially exposing their employees to bloodborne pathogens, they need to make sure their employees are trained on bloodborne pathogens, and the pharmacy needs to have something called an exposure control plan. And basically that is the pharmacy's plan to help mitigate and control exposure to bloodborne pathogens. You want to do an annual review of that. You want to do an employee survey, make sure the employees, see if they have any questions about the practices that are put in place. A syringe assessment for your employees that are providing immunizations and things like that. You want to make sure that that they're comfortable with the syringes they're providing. So the syringe assessment basically is they all sit down together and they kind of identify any new products that may have come out on the market, and also evaluate the products that they are using in the pharmacy now to see if there may be a better one. And then obviously employee training. So you want to train your employees on bloodborne pathogens, and also what the pharmacy is doing to prevent their exposure. Just real quick, we are in the process of adding a feature to the system that will be under the Tools tab on the website there, that basically you'll be able to tell the system to email specific people when tasks are coming up. Lastly, before getting to the questions, just want to cover this real quickly. As many of you know, on October 20th of 2020, Department of Health and Human Services released guidance that basically talked about how pharmacy technicians can now provide childhood vaccines and COVID-19 vaccines. They can also do COVID-19 testing, but they have to meet certain qualifications of those. One thing I do want to say about this is you definitely want to check with your state board of pharmacy, see if they've come out and said, in no way whatsoever are we going to allow this. But the guidance from HHS says this overrides all state laws. So we partnered with National Pharmacy Technicians Association to give CPA pharmacies access to this program. What this program does is basically be a certification program for your technician. So for you pharmacists that are certified to do vaccinations in your state, this is very similar to that, but it's for pharmacy technicians. So the pricing we see here, they will receive, I believe it's 6 or 8 hours of CEs, the technician will. And there's a couple different programs here. We have our individual technician immunization administration training. Basically, this is the program. The main program is for one technician. The price is $149, but you can also get a site license, and that's free for a pharmacy. And that pharmacy can basically, for $399, they can train any number of technicians in that pharmacy to provide vaccinations. So you see there's a $100 discount. And then immunization lab kit, that's basically a kit of the supplies and equipment used to basically do the skill part of the certification. Now, in a lot of cases, you may already have those in place. And if you don't, you may be able to get them from your drug wholesaler at a cheaper price than what MPTA is offering the kit. Point of care testing, this is the exact same thing. It's basically going to certify your pharmacy technician and point of care, and the pricing is the same. $149 for an individual, or $399 for as many technicians as you want until the end of 2021, and then another lab kit. One of the requirements of any vaccination program is the individual needs to be certified in CPR or BLS. So NPTA has also done this. If you have a pharmacist that's already certified in CPR, then that NPTA will actually help you make that pharmacist a certified trainer. So the technician will go through the training, and then the pharmacist will actually certify them based on the documentation they were given by NPTA. And then they offer some better pricing if you purchase a bundle. So if we look at the first bundle here, that's for all three: immunization, point of care, BLS. The price on that is $898. And then if you just want to do immunization and get the BLS also, the price on that is $598. As you may have seen on the website, there was a green box. If you want to get the best pricing, just click register. If you want to see the pricing, we have a document that they can read and look at. You can click on pricing, and that will send you right up. The register will send you right over to the NPTA website for you to sign up. All right, there's our contact information. I know we're running a little bit late. I'm going to go ahead and start answering any questions. Any questions I do not get to, I will make sure that I'll send everybody, or I'll make sure CPA has a copy of those questions and answers, and we'll make sure that that you guys have a copy of that. Okay, looks like we only have, well, there we go. All right, so the first question I have here, is there a place to document that we've completed the various HIPAA and fraud, waste, abuse items? Yes. On the annual ones, there is a document for that. I will double check the monthly ones, and if there's not a monthly one, I will make sure that that's created also. And basically what that is on all the programs, there's an annual assessment. And in that annual assessment, you'll be able to document and record those. And then when the new system comes out, you'll actually be able to document and record those on the website itself. All right, yeah, so if you do have any questions, you can use the GoToMeeting software to ask those questions, and I will read those out and answer those. All right. Okay. When checking OIG exclusion, I have an employee that shows a SAM result, which I have verified is not my employee. How can I keep them from reappearing? So I'm going to jump over back to the website. So when you're in Exclusion Track and you're in the current report, looking over here at the attest, if the employee is coming up and it's not a possible, a name mismatch, there will be a false positive link here. You click that link, and it's going to have you attest that that is not your individual. Once you do that, that check will not appear again in subsequent months. Question, what is a Form I-9? The Form I-9 is the federal form that needs to be completed by every employee on your system. Basically, every employee that you have hired, basically that is a form that you use to document that you verified their identity. They provide a driver's license, a security card, and there's a couple of documents they can provide also, but you need to have one of those for each of your employees if they were hired after 1989, I believe. And the Vera I-9 track has a link to where you can get copies of those forms from the federal government. Can you confirm which services are included in CPA membership and which are additional? So going back to the Home tab here, all the programs that we see for this PRS Pharmacy Services C-Track suite, those are all included in your program. So Culture Track, Drug Supply, down the line here. The two programs that I went over or mentioned that are not included are the ECP program, the Exposure Control Plan, and the USP 800 program. There's some other programs that we have also, but those tend to be the bigger ones that we see pharmacies looking for. This ImmuTrack program is basically best practices for the provision of immunizations, and that one actually includes its own exposure control plan and bloodborne pathogen training inside of that. And as part of what I sent over to you guys, I'll make sure there's a document of describing each of the programs also. Looks like no other questions that I see right now. And we're hitting 2 o'clock, so if you do have any other questions, obviously you can contact us directly, and any questions that I receive before I publish the Q&A, I'll make sure is on the Q&A document that I send over to CPA. But here's our contact information here, and also on the website, down at the bottom, there's our contact information there also. So we have our phone number and our email address. And then if you go to need assistance, also there's our email address and our phone number. So you can give us a call at any time. If you do have questions on the programs or how to log in, obviously you can give us a call and we can handle that too. And if you want to do anything else, combine pharmacies together or anything like that, we can handle that. If you do have an issue logging in, you can give us a call and let us know, and we'll be able to handle those. But it does not look like there's any other questions at the moment. So, Erica, if we want to.
Yep, that sounds great. So thanks everyone for joining the webcast today. And a big thanks, Josh, to you for putting this together and taking time to answer questions. And as I mentioned at the beginning of the webcast, if you missed anything, we'll have this recording posted on the website with the questions that were asked at the end in written form by early next week. So I think that's all, and thanks everyone, and I hope you have a great rest of the day. Thank you, Josh.
All right. Thank you, Erica. All right, thank you, everyone. Again, if you guys do have any questions after the webinar, please don't hesitate to give us a call. We have a team here that could answer your questions, and anything that we are not able to answer, we'll go find the answer for you. So thank you.
Thank you. Bye.